Alright, so for the next type of cancer we should be looking at is cancers that could actually affect the ovaries. Alright, so it's known as ovarian cancer. Now ovarian cancer can be at different stages, alright, based on the progress. Alright, how bad has it actually affected the ovaries? So the ovarian cancer, we just say, is a type of cancer. It begins in the ovaries. Now ovaries are actually part of the female reproductive system. This is where the eggs are. So you can start imagining the effects of this cancer. All right, if it is affecting a place where you are actually finding the eggs that the sperm is supposed to fertilize. All right, so it's often called a silent killer. Now this is because it typically causes few or no symptoms in the early stages. It will just be there eating the woman up. So it makes it difficult for you to be able to dictate if it eventually starts spreading. So what is this ovarian cancer in the first place? It occurs when abnormal cells in or near the ovaries, they begin to grow uncontrollable. You see, the normal ovaries is small. If it's now start growing so big, there's an abnormal growth. So the cancerous cells can invade nearby tissues. They can spread. Cancer spreads to other regions, right? So most ovarian cancers are epithelial tumors, which start in the outer layer of the ovary. Okay, so types is you can have the epithelium. This one is on the outer surface. You can have germ cell tumors. This one is like the cancer is affecting the eggs. All right, to be specific, you can have stroma tumors, which is basically affecting the tissues that produce hormone. Okay. So symptoms is often vague, mistaken for other conditions. Like it's just general symptoms. You might now feel it's something else, not knowing that it's actually ovarian cancer. Abdominal pain is a general stuff. Abdominal swelling is a general stuff. So pelvic pain and abdominal pain. Feeling full quickly. This is abdominal bloating or swelling, though. Right. Frequent urination, fatigue. You are weak. Changes in bowel habits too. So risk factors is mostly common in women over 50. All right. So family histories, especially BRCA1, BRCA2 gene mutations. All right. Never having been pregnant before. Endometriosis, hormonal replacement therapies, Ashkenazi Jewish ancestry. So diagnosis is all those pelvic examination, transvaginal ultrasound, CA25 blood test. Right, it's a tumor marker. It will help you to know that this particular cancer is in the body. So CT scans or MRI, biopsies. So treatment is surgery just to remove the ovaries that are affected. Okay, chemotherapy, targeted therapy. They can also still give you some 1 or 2 hormone therapies just to balance hormone levels in the body. So that is what the ovarian cancer simply means.